You know, Jordan, we've all heard of feel the burn when it comes to exercising. You know, we're all trying to melt the fat away.
That's right, but there's actually a new procedure, and it's removing the fat, and it's actually as cold as ice.
It's called CoolSculpting at the offices of the Bengtson Center for Aesthetics and Plastic Surgery. Okay, today we're talking about removing fat in a non-invasive way that actually is really pretty easy to get through, especially if you don't like needles. We're here with Dr. Brad Bengtson in the Bengtson Center for Aesthetics and Plastic Surgery to talk about this brand new procedure called CoolSculpting.
CoolSculpting. Yeah, it's very exciting. So CoolSculpting is the first FDA-approved, non-invasive fat reduction system. And so what it does basically, and we have a patient here today we'll be chatting with in just a second. What it actually does, it suctions the skin and fat up into between these cooling plates and then essentially freezes the fat between the plates. And then our bodies just start to kind of recognize the damage to the fat cells over time and just kind of absorbs the fat, back, through our body over the next subsequent weeks after treatment.
So they may be overall at their ideal body weight, but they just have these areas they just can't get to go away.
That's right.
All right. Now, in terms of the procedure itself, non-invasive, it's only been around since September.
Right. So it was FDA approved last fall, and it's the first FDA and really only FDA approved agent. There's some other competing technologies coming out, but nobody really has the data to really back up the techniques in use. So it's not painful. Most patients are like, it's like about a 1 or 2 out of 10. Patients will come in, we have a big screen TV, they can watch movies or TV or watch you guys on 8 West. A lot of patients will come in and work on their laptops or just sleep or just relax. A lot of times also, because it's totally unpainful, we can actually come in and do different other treatments. So we can do Botox injections or microderms or other treatments during the time that they're actually having the CoolSculpting done.
So describe the process, exactly what happens.
Yeah, so basically we put just a little gel pad on in the area. We mark where the area that we're going to treat, and it has to be, the skin has to be kind of loose enough that we can actually suction it up into between the plates. And then we just apply the pressure, the suction pressure, and then the cooling plates just really cool the fat down. The treatment lasts about 1 hour per area. And so the patient comes in, wants their lower abdomen and each flank treated, it'd be about 3 hours, of time. Right back into normal activity, really no downtime. We have patients go right out to dinner. Or I think David actually has a tennis lesson in about an hour and a half, so he'll be able to go right back into action.
Right back at it. Yep. Okay, well, let's talk to our patient. Okay, David Brower's 38 years old. You're in great shape. You are the tennis director at East Hills. Tell us why you decided to do this.
Well, Dr. B is a corporate partner of ours at East Hills, Orchard Hills, and the MAC. And about 3 weeks ago, I got a call from our corporate sales director, Wendy Micah. And she was setting this up, and she needed a volunteer. And I've known Wendy for a long time. And I said, yeah, I'll do it. Be happy to try it, for sure.
So you're in great shape.
Thank you.
Did you have a little bit of concern about your midsection? I mean, it's a tough place probably for men to lose weight.
Yeah, for sure. I mean, all of us try to stay in as good a shape as we can. You eat as well as you can, and you exercise, but it's usually hard to get rid of the last 10%, wherever that might be for you. For me, as a guy, 38 years old, it's usually around the midsection. So no matter how many crunches or yoga classes or tennis lessons you do, there's always going to be a little bit there. So it was intriguing to me for that as well, and I'm hoping that it works well.
Okay, how does it feel?
It's definitely a lot of suction, not uncomfortable. You can feel that it's getting pretty cold. I think it's been on for 2 or 3 minutes now, but the nurses told me that after about 5 or 6 minutes I won't feel anything.
Okay, and so then after you get done here, you really are taking Dr. B's word literally, because you're giving a tennis lesson in about 2 hours.
Yep, about an hour and a half from now, I'd say.
Fantastic. All right, so CoolSculpting, if you have that hard to get rid of fat in your trunk area, give Dr. Bezos a call. Well, we're happy to be joined here today by Dr. Brad Bengtson. Okay, tell us, did he make it to the tennis lesson on time?
As far as I know, everything went off without a hitch.
Fantastic.
Yeah, he's a great first patient.
Great candidate for that. We actually have some amazing before and after pictures that we really want to have you talk us through, because it almost seems like it's hard to believe.
Yeah, you know, I think where I position this is the patients that have some isolated areas of fat that are like 5 to 30 pounds above their ideal body weight, or many patients are actually right at their ideal body weight, but just have little genetic kind of collections of fat they just can't get rid of. Those are really the ideal patients. So particularly in the trunk for men, just really takes about an hour, and just patients come in, and it's a very minimally painful, really no downtime, get right back to your life.
And when you look at the pictures here, is it the body is actually really, over the weeks and the months following the procedure, really getting rid of this?
Right. Yeah. There's a lot of myth and misconceptions about fat and liposuction as well. As long as you maintain your diet and exercise, the fat really does not return or come back. So, you know, it really is up to the patient to really maintain their activity. But the way this works, really, the suction system cools the fat and selectively destroys or breaks up the fat cells, and our bodies just naturally absorb them over the next few weeks.
Well, what I love is that this isn't just for women. You know, men can do this too, and it's not just for someone who wants to lose like 30 to 50 pounds. Like, you could work out all the time and just have that maybe an inch, 2 inches that you need to lose, and this would be the perfect procedure.
Right. Yeah, we all have to do our part. There's no substitute for weight loss, right? Yeah. So, but it really is very ideal for those sorts of patients, and as you said, great for guys. You know, I think we tolerate a little bit less downtime,
Right.
and so it's really a great alternative.
And you were saying that the FDA has approved it for the trunk area, which really does make it a great option for men.
Right. Yep, we use it in the trunk, and definitely we're applying it to other areas of the body, back fat, those sorts of things. It's kind of an off-label use, but as long as we can get the system set up, and the skin will actually be retracted into between the cooling plates, then we can treat the areas.
The muffin top there, you see?
The muffin top
tops
that
are
no
great,
one
yeah.
wants.
Exactly.
Well, I was actually at your last event, and the neatest thing was I was there with a microphone talking to someone who was doing the procedure, the CoolSculpting, and they were reading a magazine. There was no downtime, and I said to them, what are you actually feeling? And they said it was as simple as if you have a vacuum and you're cleaning and you put that on your arm. That's a little bit what it felt like.
Right, exactly. There's just a little bit of a suction pressure, and so we have a big screen TV in our procedure room where patients have this done, so they can watch 8 West if it's on, or
Perfect.
movies. I think Dave was watching Transformers 3 or something.
Yeah, I was going to say your library of videos has had to change a little bit now that you have these great procedures for men.
Yeah, that's right.
They're not all watching, you know, Autumn in New York.
No Pride and Prejudice. Yeah.
Exactly. Okay, so you have an event, a couple of events coming up where people can come and learn about CoolSculpting and some of the other great procedures that you offer.
So we have our big kind of kickoff events for CoolSculpting this Thursday night, and then we have another big event planned for, I think it's November 30th.
And they're at the Women's Health Center, beautiful facility. What can people get there aside from information? Your parties are really pretty tasty.
Yeah, it's fun. I mean, there's always surprises, you know, so we'll have definitely some surprises. Our estheticians are there, and so we're chatting, you know, with people and potential patients about a lot of different things.
Well, you have so many services that you offer. Such a great party planner as you are, but you also are offering a really great special.
Yeah, we have a lot of specials for the 8 West viewers that come to our event. Some special discounts on that. I think they're going to list on the screen there.
And if you call today, you know, we love this because the day that you appear on 8 West, we always have a super special that's just for that day. If you call today, you get 20% off one CoolSculpting treatment or 25% off a package of treatments. You have to call today. That's 588-88 $80. And you were saying that in terms of a price point, that CoolSculpting, because of how really minimally invasive or non-invasive it is a really affordable option.
It is. I think it's probably about half to a third the cost of liposuction or an actual surgical procedure. So patients that aren't having surgery for another reason, a lot of times liposuction is very easy to add on in those areas, but it's a good alternative.
Fantastic. All right. Well, you got a call today to take advantage of those great specials. Dr. Bengtson, thank you so much for
Thanks for having me.
introducing us to this. I know Jordan was so
Very
excited
cool.
when she found out about it, and it was really interesting to interview David and see the procedure firsthand.
Yeah, I told her we'd take care of her 5 fat cells.
Yeah, I was going to say, you have to actually have fat cells.
I love them more and more every day.
Very charming. Well, we're just
Thank
getting
you so
started
much.
here on 8 West today. We've got so much going on. Coming up next, we'll talk with our hearing experts about a special upcoming open house where you can learn more about hearing aids like this one.
And it's really good when you're thinking about going with that loved one who's thinking about doing something with their hearing issues, and we'll sit down with an audiologist and a patient at Kesmarski's Hearing Services.
And whether we like it or not, it's time to start thinking about our furnaces. So we have another new expert on board. Glenn Vermeulen of Michigan Building and Mechanical is here with us in studio today to talk about their services and a special they have for 8 West viewers.
That's right, and October is Breast Cancer Awareness Month, a disease that strikes about 8 women in her lifetime.
1 in 8,
1 in
yeah.
8, which is huge. And of course, early detection is key, and we'll talk with a doctor from the Spectrum Health Medical Group about an upcoming online chat.
So stay right there. We'll be right back.
Your all-access pass to everything West Michigan.